Assalamualaikum warahmatullahi wabarakatuh. Thank you for this opportunity. Let me introduce myself. My name is Bangunawati Rahajen. I'm from Department of Pharmacology and Clinical Pharmacy, School of Pharmacy, Faculty of Medicine and Health Sciences, Universitas Muhammadiyah, Yogyakarta. I will present my study with the title Evaluation of the Side Effect of Anti-Tuberculosis Drug on the Quality of Life of Tuberculosis Patients in RSKP Respira, Yogyakarta in the period January to June 2019. This is the outline of my presentation. I divided into 4 sessions: background, the method of my study, result and discussion, and then the end of my presentation will close by conclusion. This is the background of my study. As we know, the treatment of TB infection have to in the long time, in the long duration. So because of that, in the treatment of TB infection, side effect is more happen than any other treatment. The side effect of drugs such as joint pain, nausea, and lack of appetite. The side effect of anti-tuberculosis drug is reported disrupt daily activities, so that it can affect the quality of life of TB patients. The aim of my study is to determine the relationship between the side effect of anti-tuberculosis drug and the quality of life for TB patients. The method that used in this study is a prospective observational study design with a cost control method with interview and WQL brief. WQL brief is the short form of WQL. WQL WHOQL brief is consists of 26 questionnaires. The patient who routinely undergo treatment is involving in this research. The 35% tuberculosis in Respira Hospital, Yogyakarta. This is the of my study. A total of patients, 35 patients, 100% patients experience side effect of tuberculosis treatment. 33 patients or 94.3% had a good quality of life, and 2 others had a poor quality of life. The relationship between side effect and quality of life is divided into 2 categories: the severity of side effect and interference with side effect on daily activities. A total of 23 patients is about 65.8% experience mild side effect, and 12 patients, 34.2% experience severe side effect. A 45.7% admitted that side effect did not interfere with activity. 9 patients claimed side effect interfered with activity. The relationship between the severity of side effect with quality of life get a p-value more than 0.05 with the odds ratio of 1.2. The relationship between drug side effect and quality of life get p-value more than 0.05, then both of p-value indicate that no significant relationship. Thus, it can be said that the side effect of TB drug does not significantly affect the patient quality of life. This is the table that mentions type of side effect that happen in the sample of my study. This is about 16 side effects. The most The most common side effect is red urine, then followed by nausea and lack of appetite. Joint pain, tingling, itchy, fever, stomach aches, feet burn, headaches, reddish skin, increased uric acid, liver disorder, feet feel cold and shaky, and out of breath. This is the classification of side effect. We get a mild side effect, 23 patients, and severe side effect, 12 patients. The type of mild side effect is no appetite, nausea, stomach aches, that due to rifampicin, the use of rifampicin, joint pain, tingling sensation, and burning in the leg due to pyrazinamide and isoniazid, reddish color in urine due to rifampicin. This is the management of mild side effect when patients have no appetite or TB drug can took at night before bedtime. If there are joint pain, you can give aspirin on vitamin B, 100 milligram per day. And when patients have reddish color in urine, you have counseling the patient if there's no severe side effect. This is the severe side effect. For example, itching and redness that can due to all type of antituberculosis drug. If a patient on antituberculosis medication said complaining the hive, rule out other possible causes first. Give antihistamine first while continuing antituberculosis drug under close supervision. In some patients, the itching disappears, but in some patients, skin redness occurs. If this is the case, stop all antituberculosis drug. Wait until the redness disappears, and if the symptoms of this side effect get worse than before, the patient needs to be hospitalized. This is the other side effect that from streptomycin you can get deaf. In this case, streptomycin have stopped. This is the side effect of ethambutol, vision impairment. You have stopped ethambutol and you have stopped rifampicin if purpura and shock it happen. This is the statistical correlation of severity of antituberculosis side effect with quality of life of TB patient. This is the p-value 0.111, and this is the odds ratio. That means the patient with severity side effect were 1.2 times likely to have poor quality of life. This is the statistical relationship between antituberculosis side effect and quality of life in TB patients. So I can conclude my study that it can be said that the side effect of the TB drug does not significantly affect TB patient quality of life. This is all my presentation. I hope you enjoy my explanation, and I will try to answer a question. Thank you. Assalamualaikum warahmatullahi wabarakatuh. 9.